5 years ago, Massachusetts General Hospital was given the opportunity to develop a program aimed at shaping a new model of care for the sickest 15% of Medicare patients who typically account for more than 75% of healthcare spending. The MGH Care Management Program focuses on assigning each patient a care coordinator nurse to help orchestrate all aspects of their care. So far, the program has exceeded expectations by significantly reducing hospitalization, emergency department visits, and mortality rates while cutting Medicare costs by 7%. For every dollar spent, MGH has saved $2.65.
I attribute the success of the care management program to several important components. One is the dedication of the team that's involved. They are a group that is very much focused on the success and the healthy outcomes of all of their patients.
Dr. Eric Weil is the medical director for the program, which serves over 2,500 patients. He says the program's initial goal was to improve efficiencies within the system by improving communication and organizing workflow.
Our theory from the beginning has always been that if we are able to deliver a better and more efficient quality of care, that will flow downward towards cost savings. So our belief, our hope was always that by keeping patients out of the hospital, by keeping them healthy, would reduce costs. And I believe that's what we've achieved.
Gloria Brunet has been in the program since the beginning. Now 89 years old, she is healthy and independent, but she relies heavily on her care manager, Robin Grossman, to stay that way.
Oh, I feel great. I feel very safe with the doctors and the nurse and everyone that's been assigned to me.
Gloria's a fantastic lady, very on top of things, but she's had some challenges that I've been able to help her with, I think.
It's wonderful because you can't always get a doctor, you know. He's busy or she's busy, and you're not going to get a response right away, but when you call Robin, you're taken care of right away.
What are you going to do with him tomorrow?
Robin and the other care managers handle a caseload of as many as 250 patients each. They make regular calls to check on every patient, and they are a point of contact when their patients experience a problem.
You know, they can call me because they couldn't get through to the front desk or something about an appointment, needing a refill, a question that they want to ask the doctor. They're not really sure where to go with it.
Robin is teamed with Dr. Will Schmidt at Mass General's Charlestown Health Center.
He has a problem because he has this terrible tinnitus.
Together they design and implement a cohesive system of care to prevent complications from turning into hospital visits.
If you maintain access, if you make the calls and stay in contact with a patient, then they won't go to the emergency room. So the goal isn't so much to look at the ER utilization numbers. That's a byproduct of the program. The goal is to look at the patient, find out who the sickest patients are, and follow them closely.
Martha Glennon is another of the care managers in the care management program. She supports patients of Dr. John Godine, medical director of the Mass General Diabetes Center.
It's a real team effort. Everybody's involved in it, and I just sort of help everybody be in touch with each other and coordinate the care so that all the players who are working on this patient, inpatient and outpatient, in the community know each other, know how to contact each other, are able to benefit from each other's assessments and planning and treatment.
I regard Martha as a gigantic safety net that I know is underlying me as I go about my daily activities, that if something is happening with one of these patients, I'm likely to hear about it in a very sophisticated and timely way that wouldn't have been available to me otherwise, and I probably would have become aware of the problem when the patient ended up in the emergency room.
Care coordination is really effective when you work with the primary care physician in the practice.
We have worked very hard to make the care coordinators, the care managers, into stakeholders. They feel very much invested in the work that they're doing, and that's certainly one of the reasons why there is a lower level of burnout. They take ownership, number one. Number two, we've built a team of social workers and nurses and pharmacists that work together and support each other and actually meet on a regular basis, both to review challenging cases, but also to support each other through difficult situations.
Better care, better outcomes, and lower costs are absolute metrics that point to the program's success. By forging stronger relationships, the care management team is helping patients take better control of their own health. To learn more about the care management program, visit massgeneral.org/care management.